Okay. Hi, Amy. Welcome to the Genetic Genius podcast. I'm so excited to have you as a guest today.
Thank you. I am so excited to be here, Dr. Lulu. Thank you so much.
You're welcome. Happy December. We're almost into December here, and the weather's shifting. I don't know. Where do you live?
So I'm in Buffalo, New York.
Oh, okay. You're probably
And
already cold there.
yeah, we've actually been really lucky. We've had a very long fall,
Hmm.
even some almost like Indian summer days, which for us is unusual. And
Hmm.
we often can get snow in October.
Oh,
And
wow.
we've been in the 50s the last few days. So today it's raining and it looks like we're heading into our true winter coming up here.
Winter is around the corner. Yeah, totally. Okay, wonderful. Well, before we dive into our wonderful podcast today, I'd love for you to share your story with listeners so they can get to know you a little bit better about who you are, what you do in the world, your impact.
Sure. Well, I live in Buffalo, New York, but I'm originally from the Washington, D.C. area in Virginia. And, I have a long, varied career path. I've done everything from retail professionally to I was an executive at an IT consulting firm for a number of years. And ultimately, I found my way to massage therapy school, like
Mm,
you.
yeah.
And I have been a practicing therapist since 2012. And
Hmm.
when I went to massage therapy school, I wasn't really sure what I was going to do with that. I mean, I knew I wanted to work in massage therapy.
Hmm.
I was fortunate when I was very young to be exposed to the trigger approach, which I don't
Mm, yeah.
you
Hmm.
might be familiar with, but so it's a body work approach, and I had a chance. I grew up in a very affectionate family. We
Hmm.
were we were verbally affectionate, we were physically affectionate, and so I knew the power of touch and
Yeah.
how important that is. And so when I went to massage school, I just knew that I wanted to work with people, to kind of give that comfort. And I was fortunate to be exposed still early on in my schooling to a subspecialty called oncology massage.
Hmm.
And that really, really touched me. And the reason it did is because I have a long family history of breast and ovarian cancers.
Okay.
My
Hmm.
mom, my grandmother, generations back, my aunt. And so we always knew I was at high risk and that
Hmm.
there was a high likelihood that I would have to deal with one of these at some point. And having watched my mom go through her experience with breast cancer, she was 38 at the time, I was 12. Um,
Mm.
and I just saw it was almost a full year really of that experience and that surgery and treatment. And I saw the toll it took on her. And when I learned that there was this path of oncology massage that would allow me to serve people going through such a difficult time in their lives, and to be able to bring them moments of comfort, even if they were just moments, it just really really struck a chord with me. And so that is what I've been doing ever since.
Mm.
Some blips and bumps along the way with moving states and all, but I've been a practicing oncology massage therapist for 8 years. I added the title of certified manual lymphatic drainage to my
Mhm.
my resume a few years ago, because I knew how important it was for MLD to be able to support those going through cancer treatment. And at the same time, I also went through my own experience with cancer. So
Mm.
confirmed my BRCA1 genetic mutation in 2016. And
Mhm.
then in 2017, I was actually diagnosed with stage one invasive ductal carcinoma and went through surgeries and chemo and all of that. And that's kind of led me where I am now. I had to do a lot of soul searching at that time to figure out, after going through my own experience, how did I feel? Did I still want to be working in that space? Was I
Mhm.
going to be able to serve my clients in the best way? Was it serving me or possibly hurting me to be exposed to other people's experiences all the time? And a lot of time, a lot of thinking, a lot of working, and I just realized that it was exactly where I need to be. That I was more drawn
Mm.
to it than ever. Um,
Mhm.
and I was really fortunate because having had all of this professional training and education, and then all of this personal experience, professional experience working with others, and in particular women who are going through breast cancer or living with the history of breast cancer, really gave me insight into my own experience with it
Mm,
that I think a lot of women aren't I hate to use the word lucky, but aren't privy to,
right.
because
Mm-hmm.
so many women are blindsided. Most women don't have a genetic mutation. Um,
Mm-hmm.
out of the 1 in 8, I think like less than 20% of us typically
Mm-hmm.
have a predisposition that we're aware of. And so most women, when they are diagnosed, it just completely catches them off guard. And
Mm,
I wasn't caught off guard. I
mm,
not only knew that it could come for me, but I also knew a lot of information about it. I knew what
mm-hmm.
surgeries could look like. I knew that it wouldn't necessarily just be a one and done. I knew that, the toll chemo could take and radiation, and that these things don't that cancer doesn't just stop being part of your life once the surgeries and treatments are done. Even
Right.
when the cancer's out of your body, and even when everything is over with, we don't just all of a sudden experience this new normal.
Mm,
And that was just, really important for me to be able to use the experiences I've had. I often say I live at the intersection of personal and professional experience in breast cancer land. Um,
the crossroad,
yeah,
huh?
yeah, it was just really, I realized that I had this opportunity to use all of this information and experience and help others in a really unique way.
Mm,
And so this year, I actually launched a business called As We Are Now, and I work specifically with women impacted by breast cancer. And it's right now it's in a community membership format, so it's a safe
mhm.
place to come for women to gather, and we work through some of the, not just breast cancer, but like what it's like to be a woman and then have these things added on, through
Mm,
lens. Because honestly, so much of what we deal with after breast cancer isn't just about breast cancer. It's about what we've always dealt with as women, like body,
right.
like how to take care of our health and our family and
Mhm,
all of these things. But then breast cancer kind of adds these really unique compounding effects.
mhm.
And so that's who I am, what I do outside of all that stuff. I love to travel. My husband and I are avid travelers.
Nice.
Yeah. I was listening to I listened to a couple of episodes of your podcast, but I loved your introduction because there was just so much that spoke to me and that we had in common.
Mhm.
I didn't do the long extended solo travel, but my husband did after we were together.
Oh,
And
fun.
yeah, so there's just a lot of neat things like that I noted. But yeah,
Yeah. Oh, what a powerful story and what a blessing you are to the community. It's just such a, like you said, a merge or crossroads of those two things together. It's just, there's not a lot of people that can have both. Like it's like you were preparing, in a different type of a way, and you had the knowledge. And we'll talk all about those different aspects as we move through today. And, it's really interesting, I think, to empower people or women specifically at the level that you are, because there's not a lot of support. Like you said, it's just kind of like, here you go, you're diagnosed, and then things just kind of fall through the cracks. And there's so many different levels, I think, especially of the women of 2020 that we have going on, right? But maybe we're moving into a new direction with 2021 where women are having a different aspect of how they're working in their lives in a powerful way. Yep. Okay, so today we're going to be talking about your journey a little bit more in detail, and then also how you support survivors. So you talked about your website and your new programs. We'll dive into that as well. And then also how to reclaim the personal power, which I think is a big part of what you do in helping to empower women to regain that after they've gone through such a amazing and powerful journey as having breast cancer, and as being a supporter of someone who has breast cancer too, which can be a large journey in itself.
absolutely, absolutely.
Yeah. Okay. So you talked about your training in oncology as oncology massage therapist, and then also as a manual lymphatic drainage. And how did that like specifically help to prepare you and others with breast cancer specifically? Like I think you talked about kind of like your learning, but I'd like to dive a little bit more into um, could you talk about, let's say, be specific, like the specifics about how an oncology massage helps women to heal? Like that's where I'd like to go with it in the conversation, if that makes sense.
Absolutely. Um,
Mhm.
the thing about oncology massage is that it really still it, it is massage therapy. It is,
Mhm.
there are times where it can be very specific to things related to a person's cancer experience
Mhm.
and treatment, but it can also just be about giving someone, comfort, relaxation,
Mm.
relief, and all the things
Mhm.
that massage therapy can bring to the table. um,
Right.
regardless of cancer. So,
Yeah.
as I'm sure, obviously, I'm sure and a lot of people are aware that, the things that we go through with treatment, so surgeries, lymph node removal, radiation, chemotherapy, a lot of these have lasting, if not lifelong, after effects. And
Mhm.
so what we do in oncology massage, it's really about not just it's about understanding cancer, and it's about understanding each individual's experience with cancer and what they've been through and how some
Mhm.
of those impacts affect the body. So, what is it that a woman needs? I've worked with women
Mhm.
who really lose range of motion in their arm and
Mhm.
their shoulder
Mhm.
because of a mastectomy. And,
Right.
maybe they've had implant reconstruction, or maybe they've had what a different type of flap construction where they actually take
Mhm.
muscle and tissue from, say, the lats on the back or the
Yep.
abdomen. And, a lot of women don't realize how big of a surgery
Mm.
one of those can be, and that it's
Yeah.
not just, you're not just going to get up and start going about your day again. And so
Right.
sometimes it's specifics. Like sometimes we are specifically working with helping to soften scar tissue and to
Mhm.
improve range of motion, to help to, and of course, softening scar tissue can help with pain relief. Uh,
Right.
sometimes it actually is working with a woman who has, she might be 5, 10 years or more out from a breast cancer experience. Her life
Mhm.
looks really pretty normal by
Yeah.
most means. She's active, you know, and she's got neck problems or shoulder problems or back
Mhm.
problems, just like every other human on earth.
Right.
Right. But again, so she might not be coming to me specifically for what we would consider cancer related issues, but I
Mhm.
still need to be aware of her history of cancer and how she was treated,
Mm.
because something like a risk of lymphedema never goes away. Unfortunately,
Right.
it's a
Mhm.
lifelong risk. And so if I'm going to work on someone's shoulder because, they're overdoing it with their tennis swing,
Mhm.
I still need to be aware that if that's a compromised area from a lymphatic standpoint, that the way I'm going to work with that particular part of her body is going to be different than
Mhm.
that it would be maybe on either her other side or someone who's never been through a cancer experience.
Right. Yeah. So there's lots of different components that go into specific oncology massage, but also I loved what you said about, sometimes people just need to touch, right? And especially if they're going through such a challenging time emotionally, and having that touch can really help with the heart center, really help open them up and help them with the grieving process, which can be a challenging part where they're losing an aspect of themselves. And then also, when you talked about the limited or the change in range of motion, I've had patients who are athletes where, they just want to get like right back into running or get right back into their sport. But and they could, like you said, they don't realize that how much their body is going to be affected. So that's great knowledge to pass on to our listeners too, that there can be a lot of different shifts that happen.
Yeah, and what I really am excited to share and always talk about is some of the shifts are not ones that you would expect. What we just
Hmm.
talked about are kind of the physical aspects of
Right.
what people experience, but some of the most profound changes I've witnessed in people with oncology massage is the emotional and
Mm.
like psychological impacts of connecting with their bodies. And,
Hmm.
by allowing me to work, like by a woman allowing me to work with a reconstructed breast or a mastectomy scar, um, she's allowing me into a very vulnerable space. Yes,
Mm.
obviously physically, but truly emotionally. And
Hmm.
I have had women come to me who have said, I hate my breasts. I wish I hadn't had them redone. They're not mine. I have no sensation. I don't have nipples anymore. I haven't looked at them in the mirror in 2 years, or I
Mm.
won't take my shirt off with my partner when we're intimate anymore because I don't feel like me and I don't know how to relate to this body.
Hmm.
I have been absolutely amazed and humbled and grateful to be a part of um, women's stories that have changed in that way. You
Mhm.
know, that by when they've opened themselves up to me working with them and they start to kind of feel a physical connection, you know, not as that's obviously not sexual, but that's about human touch and
Mhm.
um, they open themselves up to that same thing. And so that is what, you know, one of the things I do with my hands-on clients, and one of the reasons that I wanted to create As We Are Now, is to help women learn how to do this for themselves, how to
Mhm.
reconnect with their bodies, because it can absolutely change their body image. It can change the way
Right.
they feel when they look in the mirror, and
Mhm.
when they put clothing on, or when they open, you know, when they undress. And that is just huge to me. I mean, that goes way beyond the benefits of, you know, just having a little bit more freedom in your arms or being able to pull your
Right.
seatbelt easier.
Yeah.
Yeah, so
Yeah.
really amazing.
That emotional component is so powerful, and it's a huge part of healing. It might even be a huger part, because the physical aspect, our body kind of like knows what it needs to do, right? It's ingrained, it has the memory, it has the smarts, has a nervous system, it has all the immune cells it needs for the healing. But on the emotional component, it's that sometimes those are the pieces of the puzzle that are like, I'm not quite sure what I need here.
Absolutely. And, you
Mhm.
know, we get into things too. One of the other benefits is all of this then can be happening in a relaxed state, because obviously in our society, we are living in a constant state of fight or flight. And when
Mhm.
you come out of, you know, when our bodies are going through surgery, or, you know, we've just had surgery and maybe now we're in radiation or chemotherapy, and our bodies are working so hard to heal. And we need to engage that parasympathetic nervous system. We need to get our bodies into a place where they can actually do the healing that they know how
Mhm.
to do, you know, to be able to process the not only the treatments that are happening, but to support themselves. And so, you know, that's the beautiful thing about something like massage too, is that it is also, again, it's very relaxing. Like, I
Mhm.
come from a school anyway where, regardless of working with any people impacted by cancer, I was always taught it doesn't have to hurt to be effective. Um,
Right.
and that's important to me, because there certainly
Mhm.
are a lot of times people have had an experience with massage where they've been told, well, just breathe through it, or this is going to hurt.
Right.
You
Mhm.
know,
You're
you'll
gonna be
feel
sore
better.
for a week.
Yeah, you'll feel better in a few days. And that isn't how I was trained fundamentally, foundationally with
Mhm.
massage. And so going into the field that I've gone into with it has just strengthened that for me, that this doesn't have to hurt, that we can help you get relief and feel relaxed while it's all happening. And that in turn just helps the body, it supports the body more to do what it needs to do and what it knows how to do.
And that's so powerful from the place of emotional pain too, because it's connected, and you don't want to have this like raw wound, so to speak, like being emotionally graded over and over and over again during the healing process.
Absolutely.
Okay, let's talk about the BRCA gene, which you mentioned before. So, when did you first find out that you had the BRCA gene component? And that was after your mother was diagnosed?
Yeah, it was actually only a year before I was diagnosed. So
Mhm.
I the BRCA gene was coming to light around the time that my mom was diagnosed,
Mm.
in the late 80s. And you know, it was one of those things where, so my mom had breast cancer at 38,
Mhm.
pretty aggressive triple negative breast cancer. And my grandmother had breast cancer when she was around 60.
Mhm.
Know that my great grandmother had it. So
Mm.
there was this lineage, you know, we knew there
Yeah.
was this, and so growing up, like, it was always a question, you know. I mean, from the time I went to my first gynecology appointment when I was probably around, you know, 18, um,
Mhm.
it was something we took into consideration. All those questions
Mm.
of,
Mhm.
can I use hormonal birth control? Because what about
Mhm.
breast cancer? And when do I need to start getting treated and tested and checked? And, you know, but at that time, there were a lot of factors besides just, hey, go get a test. It was things
Mhm.
like insurance related issues. Will this become a pre-existing condition? And will
Right.
you, you know, be able to get covered? And what will you do with this information? That was always the biggest question that my
Mhm.
doctor would ask me, is, if you got tested, what are you prepared at this point in your life to do with that information?
Mm, right.
So, and this was long enough ago that there wasn't the community of outspokenness around
Hmm.
genetic mutations like this, and the
Right.
what they call a pre-Viber movement.
Hmm.
And so, I just lived at high risk. Now, granted, I did a lot of, for me, it was important to feel like I was doing what I could. So for me, that meant I had my first mammogram at 23. I got them
Hmm.
every 3 years until I was 30. And then it was every year after that. Um,
Hmm.
I went for every few years, every couple of years, I'd have a transvaginal ultrasound. Um,
Hmm.
Mostly, I mean, my doctor said if you're going to have children, you should probably have them young. Like that would be better. And
Hmm.
I tried to weigh all of that. And, I also, I hit a point in my life where I didn't want to make all of my life decisions based around this idea that I could get breast cancer someday.
Right.
Um, I mean, certainly it had an impact. I certainly have stories of how it affected me, and
Hmm.
times in my life when other people don't think about these things. But
Right.
um, I basically, it wasn't until 2016 that I decided. We moved to Buffalo in 2014, and there is a huge cancer center here. Roswell Park is literally walking distance to my house. And
Hmm.
so I got in their high risk, what they call their high risk breast clinic. So every 6 months they would alternate MRI and mammogram. Every 6 months they would do a transvaginal ultrasound and blood work. And it was in early 2016. My younger sister did it, and she didn't tell my mom and I that she was going to. I think she did it in 2015, and she went ahead and got tested and found
Hmm.
out she had the mutation. And so, I mean, I think it would have come as a bigger shock to me, and maybe even in a weird way more upsetting if I had found out I wasn't positive for the mutation, because it would have put me back in this general whatever, but still high risk, and I would have had this
Hmm.
whole like mind shift of like, I've lived my whole life with this. Now what,
Right.
Um,
Hmm.
so I went ahead and did the testing because at that point, they had great genetic counselors, and
Right.
the insurance wasn't an issue anymore. And I guess I was old enough at that point. I was 40, and I decided, okay, well, I will start to make decisions around what I'm going to do with this information.
Right.
And it's funny, bizarre, but the very first appointment I had with my breast surgeon to discuss my mastectomy options was an appointment I actually made to talk about prophylactic mastectomy. Uh,
Mm.
and it caught up to me. It was a year later. It was 2017 when I was diagnosed. So,
Hmm.
but luckily, because of knowing my risk and knowing, that I had this positive mutation, everyone took me seriously around my concerns. When I had actually had a clean mammogram in December of 2016, and it was in April that I was diagnosed. And they even did a follow-up mammogram, and it was clean. And it was only through like, ultrasound, MRI, biopsy,
Hmm.
they even found it. And
Wow.
but they listened to me. I said something is going on, and mostly what I
Yeah.
needed, my head cleared more than even like.
Right.
They said, okay, we'll do these,
Mm.
like you're due anyway. We'll check all this stuff out. It's
Yeah.
helpful. And
Hmm.
luckily it turned up early.
Wow, it's so fascinating, right? So let's talk about the aspect of the BRCA gene testing or genetic testing in general. And it can be really empowering, which I think you just talked about, like having that knowledge and being able to make decisions, being proactive. But on the other side of the coin, it's not a definitive yes, it's going to happen, which is what I want to make clear to listeners, right? Like just because you have any genetic mutation doesn't mean it's going to be something that's going to be happening for you anytime in the future. It's just like a snippet, a snip, a moment in time of what your genetic map looks like. But you
Absolutely.
also had a lot of other historical aspects of your family that went into play. And that almost to me seems, a bigger part of the genetic of your genetics, right? Having that whole history of women in your family with that genetic mutation and history of breast cancer. Did you have any, like, did you know from, I think you said it was your great grandmother that was, and was there any type of, like, where was your family from? Was there a specific, like any toxins in the environment, like, heavy metals or like a mine or anything that would have affected your lineage?
My my great grandmother was in Scotland, and
Mhm.
we do know that the strain, that the particular BRCA1 mutation that we have is of Scottish descent. Like it's,
Mhm.
definitely tracks in our family.
Yeah. Mhm.
My grandmother lived here in Buffalo, New York for a long time, most of her adult life until probably at least her 30s, maybe 40, and then was in Albany. They do say in Buffalo that there is a higher, like there's just higher risks or higher counts of different cancers here anyway.
Hmm.
So if you
Interesting.
talk to certain people, they say that, and probably because this was uh, an industrial town, there's a
Right.
lot of stuff. So, and I don't even know all the stories because I'm not actually from here. My mom
Mhm.
was, but my mom left Buffalo in like her teens. She was a flight attendant.
Mhm.
I will say I can't speak for my grandmother per se, but I know that looking, when you say about family lineage and those different things, and we a lot of the times we do look for the external factors, like, well, is it,
Right.
is there a way of eating that we all happen to have, or is there,
Mhm.
we all live in the same place, and there could be something in the environment. I believe personally that probably I personally think that some of the hugest factors for me were stress related.
Mm.
I went through even good, even happy things, but I went through a long period of an extended period of stress in my life.
Mhm.
Right, not long before my cancer diagnosis, and just that kind of chronic, consistent, day to day wear and tear stress. And looking back at my mom's life and the timing of hers, she had a lot of major life events happen in her life throughout her life that
Mhm.
were very impactful and very challenging. And certainly we all do. But I've felt the direct impact of stress related illness before. When I was in my late 20s, was getting divorced, and my dad died at the same time, and I had this
Mm.
kind of undiagnosed chronic weird, like my ankles swelled, I was in extreme pain, and I think a lot of it was stress and not taking
Mhm.
care of myself, and it was basically
Mhm.
my body saying you can't keep going this way. And when I
Right.
eliminated the stressors at that time,
Mhm.
it all started to get better.
Right.
So I do, I agree with you that just having a genetic mutation does not mean that someone is going to end up with the
Right.
particular, I mean, all the, because I think there is confusion around that. I think sometimes people think that they call it, they're like, oh, you have the cancer gene. And I'm like,
Right.
oh, we all have these genes. I have a mutation that means that this gene doesn't work as well to
Right.
stop those cancer cells from turning on, from
Exactly.
dating. And I do try to help people understand that, because I think the way we talk about cancer is something that's equally important.
Mhm.
Not just the biological, metaphysical, like how it all comes together and how it all happens, but just the way we talk about it in the world.
Yeah, but
So,
it's so key how our vocabulary makes such an impact.
yeah.
Yeah. And you know, like you said too, it's not just about, there's a lot of different components, what you just said there, right? And stress, I loved how you talked about stress, because stress impacts so many aspects of our lives. And I think we've seen that in 2020. We saw that so much. All the different, people learning to deal with stress and learning different aspects of stress, and learning how, like, okay, I really have to learn how to manage my stress. It's at a whole different level now. And you hit the home button there, the home run. Like, you got to learn to manage it, because it can trickle out into your health, and your health is key. And then when you realize, oh, okay, if I just reduce my stress and learn how to manage it, my body will be able to take care of itself so much better.
It's all that, it's homeostasis, right?
Right,
Like
exactly.
literally just putting our body and our physical body back into balance, which
Hmm.
I think, especially nowadays, I think so much of our physical body is impacted by our emotional state and psychological and mental
Hmm.
states.
Yep.
And so getting that, managing that stress and keeping our mental health in a good place keeps our body in a better place physically.
Hmm. Yeah, and it can't be compartmentalized as like, oh, your physical body has this stress, your emotional body has this stress.
No,
If it's like all connected, people I think sometimes forget like if this stress, that it's still going to be connected to this aspect of the rest of your body, right?
absolutely.
So that's a
Absolutely.
good segue into like how do you think developing like a deeper relationship with our own body is so important for that healing at the cellular level, because you talked about that emotional component with cancer survivors, and even not in people that are just finding out that they have cancer, but what's
Yeah.
that deeper relationship for healing?
Well, I think, and this actually ties in really well with the whole language concept too, is that,
Hmm.
I think one of the things that we don't think about is that, so we talk about cancer in the battle language terms. We talk about it in the fight, and we're gonna beat cancer, and I don't know if I'm allowed to swear, but kick cancer's ass, and like it's
It's
this, it
okay.
yeah, it becomes like this warrior thing, and like, and I get that we all need to. I always say every woman gets to do this her own way, like how whatever
Hmm.
she needs to take on or put out or whatever to kind of get through. But I do think that when we're in that fight stage all the time, when we make cancer this other, this
Mm.
outside force, um, we're fighting against our own bodies at that point.
Hmm.
And cancer isn't other. Cancer isn't it's not a virus, it's not a bacteria, it's not something we catch, it's not something external that gets inside of us. It,
Hmm.
it's a a cellular mutation. Like we
Right.
all have the potential at all times. And I do believe that humans spend a lot of time not being very nice to our bodies.
Mm.
We take them for granted. We expect
Totally.
a lot of them. We don't give much back to them in the
Hmm.
way of, and even sometimes when we do, we're not necessarily doing it for their sake. Like even people who are, athletes and all of these things, like the what they put their bodies through to
Hmm.
achieve, it's remarkable and it's beautiful in its own way. But is it loving towards their body, and I think especially as women, this is what I see, is that we're so hostile towards our bodies. We judge them and we berate them and we feel bad about ourselves and we don't like what we see in the mirror, and we compare ourselves to everyone else. And how is your body supposed to be doing everything it needs to do for us to be well if we're giving it all this, like if we're basically treating it like dirt, I mean,
Right.
and that goes beyond what we eat. I mean, obviously
Hmm.
a lot of factors like what we put in our bodies, what we put on our bodies, and all of that. But I think even the whole self-talk, what if you were talking to a child and always kind of berating it, the child's never going to grow up to thrive.
Hmm.
And or is going to have it's going to be a lot harder, I should say, for that child to thrive.
Right.
And it's kind of the same for our bodies, like we if the more we can embrace, and this is what I have seen with the healing aspect is, when I see women learn to embrace their bodies, and or at least
Mhm.
start to acknowledge their bodies for what their bodies can do, start to shift. We actually in the community that I run, we pick a theme every month, and so
Mhm.
November was body image.
Mhm.
And one of the things that we worked on was starting to actually identify our body as her, as she, as how would you treat if this were someone else? How would
Mm.
you treat this person? And
Right.
be able to love our bodies and to recognize them for what they can do, not just what they look like.
Mhm.
And that was, there was a really beautiful moment recently where one of our members, we were talking. I do what's called What's Working Wednesday, and whatever the theme
Mhm.
is, try to find things that are going well and recognize them, because
Mhm.
that's important from a mindset standpoint.
Right.
And they're not all related to cancer, but this particular one was like, what's working now that, what's working since breast cancer for you? And
Yeah.
it could be that you actually like your breasts more now, or you appreciate what your body can do, that it
Mhm.
maybe you're in better shape, health, better physical health than you were before.
Mhm.
And one of our members said, she was like, I'm tearing up as I'm writing this, because I think back and realize how hard my body worked,
Mhm.
and how I haven't always been kind to her. And now that I finally like, I love her. And she's like, I've started to fall back into that negative self-talk from an external societal standpoint. She goes, but I do love my body. I'm so grateful for her.
Mm.
And, you know, like, I don't know, I just imagine all of her cells in her body going, thank
Yay,
you,
thank you.
thank you. Like, all
Right.
my body's love, you know?
Right.
And
Hmm.
so it does.
Totally.
It makes a big difference, you
Yeah.
know?
Oh, it's so true. Yeah. And when we were given the opportunity to examine, it's like almost like, we step outside ourselves sometimes and see, like, okay, how am I feeding myself? How am I, treating myself? How am I speaking to myself? Because we have so many different things we tell ourselves internally and externally too, criticizing ourselves. And then when we begin to see the patterns, I think that is so key. And that I love that about the group that you're doing, is just being able to talk, and having a theme each month. That's so fun to be able to have everyone think about that. Like, okay, how am I treating myself? How am I talking about myself, about my body? How have I changed since now that I'm a cancer survivor? And like you said, like maybe it's changed in a positive way. A lot of people do take charge of their health when they're given a cancer diagnosis. Like, okay, this is like, it's their big light bulb sign, the neon sign, you must change. And there's really only one step forward for a lot of people, and that can be empowering, I think, for sure.
Yeah, yeah,
Mhm.
absolutely. And you know, not even just you must change from like, okay, what are you doing in your life that's brought you to this point, but like,
Mhm.
what do you want to do from here? Who do you want to
Right.
be and how
Yeah,
do you
who's your
want to
new
be
person?
it? Right? Like, yeah.
Mhm.
And if we're, for those of us who are lucky enough to be declared cancer free, and even those who aren't, for women
Mhm.
living, say, in the case of breast cancer, women living with metastatic disease,
Mhm.
will always live with it until they die from it. And they still have the opportunity though to come into relationship with their bodies, which I
Mhm.
think, and the case of cancer, I think it's especially important to connect with your body, because so often we can get into a place where we feel like our body has turned against us.
Right.
It's
Yeah.
blame our body. It's our body's
Right. Why
fault.
did you do
Like,
this?
my body betrayed me. Yeah. And like,
Mhm.
we look at all the external factors like
Mhm.
missing breasts or misshapen breasts or whatever it might be,
Mhm.
and how the impact that has on everything else in our lives. And we start to I don't know, like, I think it's just really, really important to, if we're going to live in safety, because that's what a lot, I think every person really just wants to live in peace and in
Mhm.
comfort and a feeling of sense of safety in their body. And I think that one of the ways to do that is also not to hide from it,
Right.
not to hide from what went wrong or what can still go wrong,
Mhm.
but to kind of, when you can come to a place of acceptance and still love your body, then
Right.
you're going to be in a much better place than, either turning against it or trying to pretend it isn't going to happen or whatever.
Yeah, that self-acceptance piece is so key in the healing process, because like you said, coming to terms with that self-acceptance, but also discovering the new person that you want to be, and
Yeah.
then loving the old person who
Yeah.
has had this happen to them, and that it's just part of the life experience, and letting go of the blame. And I know that's a big piece and component that can happen. And then moving to the new place of acceptance and self-love, and into that to create the change and the place for
Yeah.
healing to happen.
Yeah.
Mhm. Um, so I think we talked a lot about mindset and how cancer is a part of us, and it's not separate. And I think that's a really key piece that I'd love for you to talk a little bit more about, recognizing, like you talked about how, we have this big, like, it's a taboo word, and once you don't want to tell anyone, and you're labeled, and then, like, and I think that when you've created this wonderful working community within to allow people the safe space to begin to talk openly and discover that they're not in a place of shame, but also, like, just being able to create new words around it, and create an atmosphere of, it's just part of life. and instead of being so judgmental, about it. So something that happens. Not everything happens. It's going to be like rosy and, with rose-colored glasses. But how can we create? So my question is, with your community that you have, how can we create a better new framework around the word cancer so it doesn't become the new bad word, or it already is the bad word, I think. But how can we create it from a loving space?
Yeah. That's a interesting question and a wonderful one. I think kind of what sums it up for me is, and I'll never forget the first time I heard this. A friend of mine went through breast cancer a number of years ago, before a few years before I did, and she was talking a lot about her experience. And one of her friends, she'd shared something on Facebook, and one of her friends said, "I love your cancer. I even
Mm,
love your cancer because your cancer is a part of you. And if I have
mhm,
to, I love you, therefore I love all of you. I love every
mm,
cell within you."
mm,
And it was just such a profound idea that, like,
mhm,
again, we don't have to make it like we don't, when we talk about cancer, this battle language, this fight, like we've turned it into this enemy. And yes,
mhm,
no one wants cancer. It sucks, it's terrifying, and going through it is really difficult. um but we don't label, like, people who've had a heart attack.
mhm.
We don't there isn't this whole, I mean, unless maybe there is, and I'm just really naive to it, but like there doesn't appear to be this whole population of the world around there who walks around with, like, heart attack survivor, heart
Right.
disease survivor, like, on
Mhm,
their, they don't have bumper stickers, they don't have
mhm.
tattoos on themselves about it. Like, it's this interesting place of, I guess what I am trying to always do is normalize it, you
Right.
know, and
Mhm,
normalize it, just like you said, that it's one experience of many. I
mhm,
I have said it before and I'll say it again, and I know that I am probably in the minority when I say this, but cancer is not the worst thing that ever happened to me. It's not.
mm,
Now,
mhm,
maybe that's because I always knew it could happen. If it had
mhm,
come out of the blue, I mean, I don't know that, I think if you ask my mom, I think she would say that her experience with cancer was the worst thing that ever happened to
mhm, mhm.
her. But it was also at a time when she had a 12-year-old daughter, a 3-year-old son, a 6-month-old
Right.
daughter. Like, there was,
Overwhelmed, yeah.
I was in a very fortunate position to be self-employed. I was able to take care of myself. My husband worked from home. He was,
Mhm,
beyond whatever I could have hoped that he might be if we were going to be in this situation. Like, I had kind of everything, in a weird way, I had everything going right for me when it came
mm,
to cancer.
mhm,
Um, I've also gone, I've been divorced before. I've lost two dads, actually.
mm,
I've had a biological dad and a stepdad die, and, like,
mm,
there are things to me that have had a much more what I would call traumatic impact, that I haven't also been able to work through as easily in some ways as I have my
mhm,
cancer experience. And so I think that's the thing, right? Like, it becomes this kind of all-consuming experience that then becomes a part of our identity, our identity. And
mhm,
that's something that I think is difficult. I know, one of the reasons I created As We Are Now in this particular community is, and it
mhm,
is focused on survivorship. And that doesn't
mhm,
necessarily mean for women who've been through breast cancer. We actually have some members who are what they call previvors, who women who
mhm,
are living at high risk and have chosen certain actions to try and reduce that risk. But
mhm.
they certainly have been impacted by breast cancer.
Right.
But someone who's going through it is at a very different place than someone who is trying to live life as a woman beyond cancer. And that's, I
Yeah.
think, what it's all about,
Right.
because it becomes this, it's either cancer is the enemy, or, and people don't, like you said, it's a shameful thing. They don't want to talk
Mhm,
about it. They hide from it. And I certainly know
mhm.
women who've taken that path. Like,
Right.
they don't tell people, they want to minimize, that people even know. And it could be for a lot of reasons, not just shame, but, fear, whatever.
Yeah.
But then, of course, there's the other side. There's the women who absolutely embrace it and take on this identity, and everything becomes about, the pink sisterhood and all of that. And
Mhm.
that doesn't work for some people either. Like, not all of us
Right.
want to I mean, we live with this experience every day of our lives, whether we want to or not. And
Mhm.
not all of us want to make it an identifier, because that's what happens with with cancer patients, cancer survivors. Like, you become that person, you become that
Mhm.
survivor. People
Right.
who know me and know this experience, um, they never see me without that survivor, uh,
Mm.
without that survivor title. And
Right.
granted, I also talk about it a lot because I've chosen to continue my work in this space.
Mhm.
But again, we don't do that with other illnesses necessarily,
Mhm.
or other diseases. And I'd like to see it become just. I guess I wish it was a little bit more in the individual's hands as to how they were able to wear this experience and this persona
Mm.
instead
Mhm.
of assigned to us
Right.
by society.
Yeah. Yeah, that's such an interesting concept. It's I don't know why we've taken that route with it. I think maybe part of it is because as far as breast cancer goes, I think because so many women have been affected and it's such a huge part of, our feminine identity. And so
Yeah.
I think maybe that's why it has become, but at the same aspect, it needs to be more loving, more generalized, more just, not labeled. And like you said, some people want to have that label because it helps empower them to take a change and help others around them, but then that should be their choice, not that they've been labeled as like, oh, you're always going to be this. And like it was interesting comparison you gave to, a heart attack, because of course we don't talk about like, oh, you're a heart attack survivor. It's just not part of that terminology, even though lots of times they have to go through huge surgeries and they're on lots of medications for maybe even the rest of their lives,
Yeah.
and that puts them at a huge higher risk for lots of other health conditions. So yeah, that's interesting. I'm going to have to think about that one a little bit more in detail. And so that's kind of why, correct me if I'm wrong, one of the reasons why you created the platform of survivorship, or you said pre survivor. Is that the terminology you use?
So yeah, I mean, I say in survivorship, and generally the accepted term of survivorship is basically as soon as you've been diagnosed. But
Right. Okay. Yeah.
but most people think of it survivorship kind of, a survivor has this connotation of being after cancer, and that
Right.
you survived it, you don't have cancer anymore. There is sometimes people use the word thriver, especially with
Right.
metastatic, so if they're living with cancer.
Yeah.
Um, and then the newer term is previvor. So
Pre-vivor.
someone who is living at high risk, at least in the breast cancer community, someone who's living at known high risk, typically with a genetic mutation or an extensive family history. And they might have gone to, whether they have or not, but some of them have actually had prophylactic mastectomies, had their breast removed prior to a diagnosis to hopefully reduce that risk, or taken other means. I also know, I know a couple of quote unquote previvors who have chosen to address their risk through diet, exercise, healthy living. I know a young, absolutely, her story is just absolutely inspirational on how she has um, learned to work with her body, after a young adult lifetime of not, and
Yeah.
feeling like we talked about earlier, feeling like she was just a foregone conclusion. And at some
Right.
point she realized, no, this is what I can do about this now. And
Mm-hmm.
but yeah, that is why, I mean, that what I realized when I came through my own experience,
Mm-hmm.
is that, one, there's a desperate need out there for education around
Right.
lymphedema risk and lymphatic
Mm-hmm.
stuff. I mean, most people don't know that oncology massage is a thing. And so As We Are Now was really born of that. And that is an
Right.
aspect that's coming soon, to help teach women how to understand their lymphatic risk, how to work with that, mitigate that risk, how to work with
Mm-hmm.
their own bodies, for this kind of reconnection and reclaiming a sense of personal empowerment. But I also realized that from a kind of a support standpoint, I didn't fit in anywhere. And
Mm-hmm.
and it occurred to me that if I don't fit in anywhere, there are other women who also don't fit in either.
Right.
And
Exactly.
it's not it's hard. I sometimes have a hard time talking about it because I never ever want the organizations that are out there and doing such good work in this space. Like,
Mm-hmm.
this isn't a criticism of them,
Right. You're just
but
creating another avenue, so to
I'm
speak.
creating another
Mm-hmm.
avenue because
Mm-hmm.
I've been around cancer for a long time. I've worked in cancer for a long time. And I
Mhm.
guess for me, it is kind of a bit more of a normal thing. And I've never been a fan of pink has never been my favorite color, regardless of cancer. Um, I have my own experiences and my
Mhm.
own ways that I relate to the pink ribbon and all of that. And I am grateful for the good it does, but I still also see the harms that it's caused, like the way that it's become this that every woman gets assigned a pink ribbon, and that
Right.
we lose our individuality, I guess, is what
Yeah.
happens when the messaging is so singular around this
Mm.
space.
Mhm.
Not every woman wants to be a warrior. It is hard. I have talked to so many women who even if that's on Facebook when their friends are going, "You're so strong, you can do this, you're going to kick its ass," or "It came back, it's okay, you're going to kick its ass again." Well, most of the time when it comes back, it's stage 4, and you're not kicking its ass. It's not going
Yeah.
anywhere until you
Right.
do.
Mhm.
And I just think that what I realized is I wanted to be seen as a woman. I wanted to be seen as the complex, unique, crazy, whatever, like all of the components that make
Mhm.
me up in life. And so when I started doing things like logging into, going into support groups online, or
Mhm.
trying different avenues, either it was all around the early stuff, women trying to
Right.
find like, hey, how is this chemotherapy going to affect me? Or what do I need before my surgery? It's all the
Mhm.
tactical stuff, which is super important, um,
Right.
but isn't relevant to me anymore, other than
Yeah.
how I can offer advice to them. Or it was in this kind of either loving, you're not, I don't want to say loving the breast cancer experience, but embracing,
Embracing.
like
Mhm.
like calling each other breasties or pink sisters, or
Mhm.
it's not me. And I didn't,
Mhm.
it's not that the information that they're putting out isn't important and good. It is. And there are women who are drawn to that. And I'm
Mhm.
grateful that it's there for them. But it wasn't me. It didn't draw me in. It made me feel like, no, I don't want to be a part of that.
Right.
I also don't really want to hate on it. Like I don't have
Right. You can embrace what you're doing and what other people are doing. It's totally fine.
Yeah, and I also don't want to, like, I mean, there's women who really are really anti, like, breast cancer awareness month, and like are really fired up about it. And I just kind of came from this place like realizing that, like, I just want to figure out how I feel about it, and
Mhm.
then work through that. Like, is this how I want to? Because guess what? How I feel right now probably isn't how I'm going to feel a year from now, or how I'm going to feel 3 years from
Right. Be in the moment.
now. Yeah, and I want to figure out what I can do for myself. Am I happy with where I'm at, or do I want to make some changes? And so, you know, the whole concept of As We Are Now was to help women um, reclaim a sense of themselves beyond breast cancer as
Mm.
we are now. Because the bottom line is, this whole new normal we're promised, it's not something you just jump into. It's not something you wake up one day and it
Like
happens.
poof.
Yeah, no, and also recognizing, like, I think especially, and this is something that even kind of occurred to me as we were or kind of came to me as I was working on the body image month, was that
Mhm.
our bodies are meant to change. We are
Right.
not static beings,
Mhm.
and so even something like cancer, in a way, like so often we see the really stark image of a woman whose breasts are gone or whatever, but you know
Mhm.
maybe, or even one remains and one is gone. Like, our bodies are meant to change and evolve. And so what can we, how can we look at ourselves, and how can we relate to all aspects of our breast cancer experience as women? And that's what we do in
Mm.
the community, and that's how the membership platform started. Because as much as I'm vocal about my experience and what I do, and I share that in the public world,
Mhm.
there's a lot I don't share, obviously. I talk about my story, and I talk about a lot of things, but there are pieces of my life, that relate to me, that relate to my husband, that, like, there's a lot of things that
Yeah,
I'm not.
personal.
And you know what? Facebook isn't the place to share them for me.
Right.
Instagram
Mhm.
isn't the place to share them for me. And so, that's why I specifically started this membership on a separate platform. It's on a Mighty network, which means the only people inside of it are us, just the members.
Mhm.
And it's also a reason that I made it actually a paid community, because I believe that there is something to be said for investing in ourselves and in each other.
Mhm.
And
Yeah.
it's not an exorbitant fee or anything, but it's enough to make sure that the women who are coming in want to be there, and that,
Right.
you know,
They're
and that we
committed.
understand why we're there, and that, you know, we're there. And some people come in and they're just quiet and they kind of absorb, and others are more vocal and they share. But, you know, it's an opportunity for all of us to do a little bit of open reflection, a little bit of
Mm.
self exploration,
Mm-hmm.
to get resources and recommendations. That's a big part of what we do.
Yeah.
And just to kind of help each other figure out, like, what do I need? I mean, I look at it really as a jumping off point. You know,
Mm-hmm.
I'm not a life coach. I'm a woman who's been through breast cancer who happens to have a lot more information and experience around breast cancer than
Right.
the average woman.
Then right.
You know, but I'm there to help you figure out, like, so together we all pile resources and recommendations and information. Like, what are some
Mm-hmm.
things around this theme that are going to help us? Oh, I'm going to go try that, or that really appeals to me, or that works for me. And obviously, because we have a community doing it together, we get exposed to things that, you know, working with just one person
Right.
wouldn't know.
Mhm.
And I look at it as a jumping off point. You know, it's like some 1 month's theme might not be an area of one woman's life where she really needs a ton of work, but another theme might be really important to her. And then you take it
Right.
on with it, you know. I mean,
Yeah.
someone might discover, yeah, I've got all these like deep-seated body issues, and maybe I need to go work with a therapist, or
Right.
gotta, I don't know. I mean, there's just all kinds of things.
Right. You never know what the jumping off board is going to be, right?
Yeah, but that's really what it's about.
Hmm.
Give women a safe space to share,
Hmm.
and without the that singular messaging, without the labels, without the, you know, I try to be very conscious about the language I use and the
Hmm.
way I say things. You know, part of that comes from the training I was fortunate to have early on in my career,
Hmm.
and then just kind of the self work I've done over the years too.
Hmm.
That's really important to me, is, you know, how we talk about ourselves, how we talk about the experience, and that we're never forgetting that we are so much more than this one experience.
Hmm. Oh, what a powerful site that you've created, and such a, I love the loving space that you've created in this way that is like all encompassing, I guess if that's the right word, but where, and inviting, I guess is a better word, but yeah, really loving, and but also not only with the support aspect, but the community network where people can provide, because I think, some people are looking for a different, not a necessarily an answer, but something different that they can do in their recovery phase to make the shift. And as you say, to be empowered for this new aspect of themselves, and having this loving space of community for survivorship that you created allows them to have this different aspect of self growth, which I really applaud you for.
Thank you. Well,
Yeah.
I mean, honestly, I heard a quote today and it was so powerful. And it really just kind of stopped me. I was listening to Brene Brown's podcast with Elizabeth Lesser, and
Hmm.
they were referring to saying how Elizabeth Lesser, a lot of people call her a spiritual teacher. And her response was, I'm a seeker. And
Hmm.
there are a lot of other seekers on the path with me. If I happen to be a tiny bit ahead, I'll do my best to lend a hand. And
Mm-hmm.
that's what it feels like to me. You know, I mean, I
Right.
happen to have a little bit more knowledge and training and experience in certain things, but this is definitely a healing path for me as well. I get
Hmm.
as much out, if not more, than I give into this space and this community. And, you know, that's kind of what it's. I mean, selfishly, I'm in it for my own purposes too. You know, because
Right.
I
You
need
get to
all this
reap the
stuff.
benefit.
Yeah, I need it
Yeah.
all as well. You know,
Well,
I
that's part of creating something, is being able to reap the benefits in a loving way, which I think you've done that. You don't want to get burned out from helping people. You want to do it in a way that you're receiving back.
Well, and it really allows me to, you know, what I realized with massage therapy, and we're in the middle of another shutdown because of COVID numbers, and
Yeah.
for massage therapy. And, you know, I realized a while ago that as much as I love massage, one of the challenges is that I can only ever help someone when they are in my studio on my table for that period of time, you know,
Mm,
one person at a time. And while that interaction can be profound, it's also limiting. And I love
right.
that in this virtual space, I am able to connect with so many women. I mean, I've, you know, got people overseas. Like I can connect with women around the world and meet women that I never would have otherwise.
Hmm.
And that also, again, you know, just expands all of our worlds.
Right.
We have that opportunity. So,
Yeah.
This business is allowing me to serve that many more women in this space, that where I really want to be helping.
Yeah, that's one thing I really appreciate about the World Wide Web, right? Is that it has created a network. And now, especially now, that's one thing I'm really grateful about from 2020 is that it has, did create this environment for us to expand the way we work together,
Yeah.
which is really awesome. Okay, I know that we need to wrap things up today, Amy. And so the name of your website, just I want people to be able to find it really clear. So aswearenow.com, but you have to have a dash in between each word, right? So
And
as
actually,
dash.
yeah, the easiest thing, sorry, I didn't mean to interrupt you. The
That's
easiest
okay.
thing to do is go to amyhartl.com.
Oh, okay, great. And that's
Yeah.
Hartl. And I'll put that in the show notes.
Yep.
Okay.
amyhartl.com is the main site actually for As We Are Now, which has more, the general information about it and how to get in touch with me and all of that. And then there are links to the actual membership platform, which is as-we-r-now.com. And that's
Oh,
the
great.
actual mighty network where the membership lives.
Okay.
But amyhartl.com gives access to me through that website.
Great. And then also on Instagram, it's the same thing, the as.we.are now.
Yeah,
They can follow you there. And then same with Facebook, right? It's all the
yeah,
same.
it
Great.
is. It,
Wonderful. So people can join the membership on your website and find out more information there. And do you have anything special happening for 21 for this year coming up?
I do. I'm going to be launching my 8-week body empowerment program. And so
Ooh,
that,
that's
yeah,
exciting.
that actually happens within the membership.
Mhm.
I don't have all the details worked out on how it's going to look,
So
but it'll
working
be,
it out.
yeah, but it'll be, I've done something similar before, but this is actually going to be bundled with the membership. And it's going to be a mix of online and virtual live learning focused around more of the physical impacts of breast cancer. So helping women understand their risk around lymphedema, how to
Mhm.
mitigate that risk, how to work with their bodies, like actually doing some self-care techniques. And then the same thing around scar tissue. So really helping women to reconnect with their body,
Mhm.
how they can do that will help them recover. And then of course, all of that really results in them reclaiming a sense of personal empowerment. Because I
Yeah.
do think that's a critical point that's missing in
Right. Totally.
breast cancer care
Mhm.
is, you know, giving women the tools, not just sending them off and saying, great, now you're cancer
Right.
free within 3 months, 6 months,
Bye.
but like giving women real tools that can help
Mm.
them feel like they have a sense of say and what's going to happen next.
Yeah. Oh, great.
Yeah. So that's
Wonderful.
going to launch in that should be launching in mid-January.
Awesome. Great.
Yeah.
Perfect. When this podcast is launching. So it's perfect timing. Yay. So I'll make sure that's in the show notes so everyone will know how to link up to that in the membership. And then one last question for you. If you had an unlimited budget right now, what would you do to have the biggest impact on the health and welfare of our planet?
Oh my gosh. So if I had unlimited budget and I could
Yep.
give money to
You
anything,
could, yeah,
well,
anything you want.
anything. Um, I think clean, fresh water.
That's a
I
great one.
Yeah, I mean, there's so many things, but I I found myself on more than one occasion recently having those weird little moments of like awakening where I realize how most of us go, especially in our country, go through our lives just taking for granted the fact that we turn on a tap of running water. And maybe it's that I went camping again recently and like,
Right.
we had a limited water supply and I just, I don't know. I just no one should ever have to work so hard or not have access to at least
Mm.
drinking water. So
Yeah, that's a great one. I'll give you all the money for that. No
yeah,
problem.
yeah,
Yeah,
great. I love that.
it's funny. My mom recently said one little thing that made me think about is that, when she was growing up, she never thought she'd ever have to pay for water, like, like buy water. And I'm
Right.
like, what? I never think about that now, like so that would be something, really great if we were able to switch things on our planet where water was accessible for everyone and free for everyone in a totally like healthy way, not a
Yep.
chlorinated, toxic
Right.
way, which we're giving
Right.
people now,
Yes.
which I totally believe that. So yeah. Anyway, thank you so much, Amy, for your time today. And I learned so much, and I'm sure our listeners are going to love reaching out to you and joining the membership, because we have a lot of listeners that are cancer survivors and that also know someone in their community. So thank you again for your time today.
Well, thank you so much. It's truly an honor, and it's been really fun talking with you. I've enjoyed it.
Good. Thank you. Well, we'll see you soon, I think.